Doctors aren't always right. Sometimes the most dangerous thing you can do is blindly accept what you're told. What you're about to learn could save you from unnecessary procedures and harmful medications. When they push statins without checking your risk factors. Cholesterol has become one of the most overtreated conditions in modern medicine. Walk into a doctor's office with total cholesterol over 200, and you'll likely walk out with a statin prescription, regardless of whether you actually need it. Here's what they don't tell you. Total cholesterol is a terrible predictor of heart disease risk. Your HDL to triglyceride ratio, inflammation markers like hsCRP, and calcium scoring are far more important. But these require nuanced interpretation, and prescribing statins is easier. Statins have real side effects: muscle pain, cognitive impairment, liver damage, and increased diabetes risk. Studies show statins provide minimal benefit for primary prevention in low-risk individuals. If your doctor prescribes statins without first checking your CAC score, hsCRP, and discussing your actual cardiovascular risk factors, you should refuse and demand comprehensive testing. A cholesterol number alone doesn't justify lifelong medication with significant side effects. Ask these questions. What's my actual 10-year cardiovascular risk? Have you checked my inflammation markers? Can we try lifestyle modifications first? If your doctor dismisses these questions, find a new doctor. Guidelines are written by physicians with financial ties to drug manufacturers. The disease isn't high cholesterol. The disease is conflicted medical guidance. When surgery is offered for back pain without conservative treatment first. Surgery should be the last resort for back pain, not the first option. Yet surgeons often recommend spinal fusion or discectomy before you've tried comprehensive conservative care. Studies show that for most back pain, surgery produces no better outcomes than physical therapy and time. A landmark study found that after 2 years, patients who had surgery had the same pain levels as those who didn't. Back surgery has serious risks. Failed back surgery syndrome affects 20 to 40% of patients, leaving them with chronic pain worse than before. Once you alter your spine surgically, you can't undo it. Unless you have cauda equina syndrome, progressive neurological deficits, or severe symptoms that haven't responded to 6 months of conservative care, refuse surgery. Demand physical therapy, core strengthening, and anti-inflammatory protocols first. The financial incentive for surgery is massive. A spinal fusion generates $50,000 to $150,000 in revenue. Physical therapy generates a fraction of that. Get a second opinion from a physiatrist. Doctors who don't profit from surgery will give you a more objective assessment. If you're starting to see how the system pushes interventions you might not need, hit that subscribe button. We're exposing the medical recommendations you should question and helping you make informed decisions. When they want to put your child on ADHD medication after one appointment. ADHD is the most overdiagnosed and overmedicated childhood condition in America. Approximately 11% of American children are diagnosed with ADHD, and most are medicated, often after a single 15-minute appointment. Here's the problem. There's no objective test for ADHD. No blood work, no brain scan, no biological marker. Diagnosis relies entirely on subjective behavioral checklists, often completed by stressed teachers managing overcrowded classrooms. Normal childhood behavior, being energetic, distractible, struggling to sit still for hours, has been pathologized. Boys are diagnosed at twice the rate of girls because their natural activity levels conflict with modern classroom expectations. ADHD medications are powerful stimulants that can stunt growth, suppress appetite, cause sleep problems, and increase anxiety. We have no long-term studies on brain development effects. Before accepting an ADHD diagnosis and medication, demand comprehensive evaluation, sleep assessment, vision and hearing tests, evaluation for anxiety or trauma, assessment of diet and exercise, and educational testing for learning disabilities. Often what looks like ADHD is actually poor sleep, too much screen time, lack of outdoor play, or food sensitivities. These require lifestyle changes, not medication. If multiple specialists agree after thorough evaluation that medication is necessary, that's different. But refusing the rush to medicate protects your child from potentially unnecessary drug exposure. When antibiotics are prescribed for viral infections. This happens constantly. and it's creating antibiotic-resistant superbugs that kill 35,000 Americans annually. You go to the doctor with a cold or bronchitis and leave with antibiotics, even though these are viral, and antibiotics do absolutely nothing against viruses. Why do doctors still prescribe antibiotics for viral illnesses? Pressure from patients who expect to leave with something, time constraints, and liability fears. Taking antibiotics when you don't need them destroys your gut microbiome, which can take months to recover. They increase your risk of C. diff infection and contribute to antibiotic resistance. And they provide zero benefit for viral infections. If you have a cold, flu, most sore throats, most sinus infections, or most cases of bronchitis, antibiotics won't help. Viral infections need time, rest, hydration, and symptom management. The exceptions are clear. Confirmed bacterial infections like strep throat, bacterial pneumonia, or urinary tract infections need antibiotics. But ask for culture results confirming bacterial infection before starting medication. When your doctor prescribes antibiotics, ask, is this confirmed bacterial or could this be viral? What happens if we wait 48 hours? Informed patients get better care. The overuse of antibiotics is creating a future where common infections become untreatable. Every unnecessary antibiotic prescription brings that future closer. When routine screening tests have more risks than benefits. Not all screening is beneficial, and some screening causes more harm than good. The medical system profits from testing, so there's constant pressure to screen for everything, often earlier and more frequently than evidence supports. PSA screening for prostate cancer leads to massive overdiagnosis and overtreatment. Many prostate cancers grow so slowly they'd never cause problems, but once detected, most men get treated, leading to incontinence and impotence from treating cancers that would never have harmed them. Thyroid cancer screening has exploded, finding tiny cancers that would never grow or cause symptoms. We've created an epidemic of thyroid cancer diagnosis without any decrease in thyroid cancer deaths. Mammography before age 50 for average-risk women is debated because false positives lead to unnecessary biopsies and anxiety. The benefits are real, but small for this age group. The key is understanding your personal risk factors. Screening makes sense when you're high risk. If you have a family history and genetic mutations, early screening is smart. If you're average risk, the calculation is different. Before accepting any screening test, ask, what's my personal risk for this condition? What happens if the test is positive? What are the false positive rates? Screening isn't automatically beneficial just because it's offered. If you're realizing you need to be your own health advocate, subscribe now. We're teaching you how to question medical recommendations and make informed decisions they don't expect you to make. Your right to informed consent. You have the legal and ethical right to refuse any medical treatment. Informed consent means you receive complete information about risks, benefits, alternatives, and the option of doing nothing. Doctors who pressure you or dismiss your questions are violating informed consent principles. Medicine is a partnership, not a dictatorship. The best doctors welcome questions, explain their reasoning, and respect your autonomy. Red flag doctors get defensive when questioned. Keep these phrases ready. I'd like to think about this. What happens if we wait? What are the alternatives? I'd like a second opinion. Refusing treatment isn't about rejecting medicine. It's about demanding better. Ask questions. Get second opinions. Your body, your choice.